Welcome to the 2017 ASHP Foundation Literature Awards presentation and breakfast. Since 1971, the program has recognized 701 authors and 163 articles published in the biomedical literature. Let's meet the latest awardees to join this prestigious group. The Student Research Award goes to Garrett Berger and his co-authors. Their article, Brentuximab vedotin, for treatment of non-Hodgkin lymphomas, a systematic review, was published in Critical Reviews in Oncology Hematology.
Brentuximab vedotin is a CD30-directed antibody drug conjugate. So, in short, it's going to be targeting cells with a higher prevalence of the CD30 antigen. And this is exactly what's happened in its FDA-approved indications of Hodgkin's lymphoma, and then one subtype of non-Hodgkin's lymphoma being relapsed systemic anaplastic large cell lymphoma. So what we wanted to do through utilizing a systematic review of the literature that's existing is take a look at 12 subtypes of non-Hodgkin's lymphoma and see how this drug does. And what we found is that it's overall quite positive in response rates with variability between the subtypes, but the point being that hopefully physicians and pharmacists alike can take a look at this data and utilize this drug in the short term with respect to salvage therapy, and then in the longer term we can hope that this drug makes its way through the FDA approval process and can truly be utilized to improve outcomes and improve the lives of those in this patient population.
The Pharmacy Practice Research Award goes to Gary Cochran and his co-authors. Their article, Comparison of Medication Safety Systems in Critical Access Hospitals, Combined Analysis of Two Studies, was published in the American Journal of Health System Pharmacy.
Most of the medication safety research conducted over the last decade is focused on large urban facilities. Little was known about medication safety in the nation's 1,300 critical access hospitals. The need for a better understanding of errors in these facilities is not trivial, as critical access hospitals comprise approximately 25% of all community hospitals in the United States. The availability of human and financial resources, both of which directly influence the infrastructure that can be purchased and supported, differ significantly in rural and urban hospitals. The adoption rates of technologies like computerized provider order entry and barcode medication administration lags behind those of urban hospitals. A lack of key personnel like pharmacists also changes the way medications are used in rural facilities. Our study compares error rates for different transcription, dispensing, and administration options frequently used in critical access hospitals. We hope that the results of our study will help rural hospital administrators select the combination of personnel and technologies that will best reduce medication errors and improve patient safety.
The Drug Therapy Research Award goes to Dima Kato and her co-authors. Their article, Changes in Prescription and Over-the-Counter Medication and Dietary Supplement Use Among Older Adults in the United States, 2005 versus 2011, was published in JAMA Internal Medicine.
In this study, we were interested in understanding how the use and concurrent use of prescription and over-the-counter medications and dietary supplements among older adults in the United States has changed over time. Using a nationally representative, population-based sample, we found that the use of multiple medications and supplements has increased, and the use of potentially fatal interacting drug regimens has nearly doubled. In 2011, approximately 1 in 7 older adults were at risk for potentially fatal drug-drug interactions. These findings highlight the important role of pharmacies and pharmacists in the detection of unsafe use of multiple medications and supplements, and in the prevention of potentially fatal drug-drug interactions.
The award for innovation in pharmacy practice goes to Melanie Ingalls and her co-authors. Their article, Standardization of Compounded Oral Liquids for Pediatric Patients in Michigan, was published in the American Journal of Health System Pharmacy.
Many pediatric patients cannot swallow tablets or capsules, and there are a limited number of commercially available liquids on the market. Therefore, medications for these patients must be compounded by a pharmacy. At Michigan Medicine, approximately 60% of oral solutions require compounding. We noticed that there was a significant gap in the standardization of these compounded oral liquids between practice sites. This presented a large medication safety risk, especially at transitions of care. With the support from an FDA grant, we set out to develop, disseminate, and adopt standard concentrations across the state of Michigan. Our initial study confirmed the wide variability in compounding practices among different pharmacies, with 455 different concentrations being reported for just 146 medications. A task force determined the standards, and they were disseminated with formulas on the MyPeds Compounds website. The significance of this project is highlighted in our ASHP publication, which found that there was a high degree of awareness and adoption of the standards. Survey respondents believe that the standards have improved patient safety and decreased error rates related to compounded liquids. Other states have expressed interest in adopting the Michigan standards, and ASHP has chosen to integrate our findings into the Standardized for Safety initiative, which focuses on creating and promoting national standard concentrations for both IV and oral liquid medications.
And this year's award for sustained contributions goes to Brian Erstad of the University of Arizona College of Pharmacy in Tucson. Dr. Erstad is currently a tenured professor and head of the Department of Pharmacy Practice and Science. He is also a center investigator for the Center for Health Outcomes and Pharmacoeconomics Research and a co-director for the Arizona Clinical and Translational Research Graduate Certificate Program. Dr. Erstad's research interests pertain to critical care medicine with an emphasis on patient safety and related outcomes research. He is the sole editor of the textbook Critical Care Pharmacotherapy and has served on numerous boards, committees, and task forces, including the FDA's Drug Safety and Risk Management Advisory Committee. He was the first and only pharmacist to receive the Society of Critical Care Medicine's Shubin-Weil Master Clinician Teacher Excellence Award, and one of only 2 pharmacists first to be recognized as a Master of Critical Care Medicine for achievements as a prominent and distinguished leader of national and international stature.
My contributions to the literature are related to my area of specialization, critical care medicine, with an emphasis on patient safety and outcomes research. In most hospitals, medication errors and adverse events are recorded using a voluntary reporting approach. However, it is well known that voluntary reporting systems are prone to substantial underreporting. Clinicians may not realize an error has been made. They may feel they don't have time to report an error, or they may think an error is not important enough to report. A number of my studies have involved a direct observation approach to medication error and adverse drug event detection. Direct observation studies are extremely difficult to conduct, both from a project approval and data collection standpoint, but they provide a wealth of information that cannot be obtained using conventional voluntary reporting. The pioneering work of this approach was performed by Ken Barker, but he primarily used it for investigating medication administration errors by nurses in non-critical care settings. I expanded on his work to utilize the direct observation technique to assess events in all phases of the medication use process for critically ill patients. Another line of my research and subsequent publications has focused on demonstrating the value of clinical pharmacists, particularly critical care and emergency medicine pharmacists, on interprofessional patient care teams. Clinical pharmacists can optimize medication use by patients through complex assessments of risk, benefits, and cost. My publications and other activities related to patient safety have led to my appointments to various national committees, including the FDA Drug Safety and Risk Management Advisory Committee. I've also participated in a number of expert panels that have promulgated clinical practice guidelines, which have been published in various medical journals. Recently, my publication efforts culminated in a textbook titled Critical Care Pharmacotherapy. I am the sole editor of this 51-chapter, 1,000-plus page text that has remained on the publisher's bestseller list since its publication in 2016.
Congratulations to all of this year's ASHP Foundation Literature Awardees.